Okay, so far we saw the right atrium. We cut open it along the sulcus terminalis. So inside we have rough and smooth areas. The rough is the anterior part and smooth is posterior part. The openings present on the inside of the right atrium are opening of superior vena cava, opening of the inferior vena cava, opening of the coronary sinus. So here is the opening of the coronary sinus, and then we have the right atrioventricular orifice. This is the right atrioventricular orifice. Still blood clot is there, and then the openings vena cordis minimi, small minute openings of the small veins of the heart, and also there is opening of the anterior cardiac vein. And then we discussed the septal wall. In the septal wall I told you the features, the fossa ovalis, that is an oval fossa. It is a remnant of the septum primum, and along the upper margin of fossa ovalis there is limbus fossa ovalis, that is derived from the septum secundum. The opening of the inferior vena cava is guarded by a semicircular valve, that is called the Eustachian valve. The superior vena cava does not have a valve. The opening of the coronary sinus is also guarded by a rudimentary valve, that is called the Thebesian valve. Okay, so these are the features. Sometimes what happens, a small minute opening is present here at the junction between the septum primum, that later gives rise to the fossa ovalis, and the septum secundum, that later gives rise to the limbus fossa ovalis. Sometimes beneath this margin a small opening is present, that is called probe patency. The minute, very small little opening, probe patency, through which very insignificant amount of blood actually flows from the right atrium to the left atrium. During embryological life, you know that the blood is normally passing from the right atrium into the left atrium. See the left atrium, right atrium, through the openings present between the septum primum and septum secundum. So later stage, if there is a large hole is present, that is non-opposition of the septum primum and septum secundum, that will result in a considerably big opening between the left atrium and the right atrium, that is called persistent foramen ovale, through which significant amount of blood can flow, and mixing of blood is quite a possibility. Normally septum primum, septum secundum, they oppose like this. You can see there is not even any gap present between the septum primum, that is the fossa ovalis now, and the septum secundum, that is the limbus fossa ovalis now in adult stage. Right, so these are the features in the smooth posterior part of the right atrium. Now let's come to the rough anterior part. The rough anterior part of the right atrium presents something called the crista terminalis. The crista terminalis basically represents it corresponds to the groove here on the outside, that is called the sulcus terminalis. So sulcus terminalis on the inside corresponds to crista terminalis. You can see this is the crista terminalis. Okay, this is the crista terminalis. This muscular ridge is crista terminalis. From the crista terminalis you can see several muscular ridges passing nearly parallelly. So these are called the musculi pectinati. So this musculi pectinati is responsible for the roughness of the anterior part of the right atrium. So this is the crista terminalis and this is musculi pectinati. All are myocardium, okay, the muscles of the heart, they are ridges. So this totally looks like a comb. It says the musculi pectinati basically means a comb with the crista terminalis and with all the horizontally running muscle ridges. So this is the crista terminalis, that is the rough anterior part of the right atrium, and here is the smooth posterior part of the right atrium. Right. So here we have the opening, the right atrioventricular orifice. So we will discuss the right atrioventricular orifice with the right ventricle. When we discuss the right ventricle, we will talk about the atrioventricular orifice. So these are the features here inside the right atrium. And worth mentioning about one important part here is the right auricle. This is the right auricle, that is ear-like appendage of the right atrium, that is called right auricle. The right auricle is a sponge-like structure. It has the musculi pectinata running in various directions. So here you have the musculi pectinata nearly parallelly running, but inside the appendage, ear-like appendage, that is the ear right auricle, we have the muscular pectinata running in various directions. So there is a sponge-like appearance on the inside. So this sponge-like appearance, the musculi pectinata arranged like a network on the inside of the right auricle. So this can give rise to formation of thrombus, okay, blood clot, and it can dislodge into the lungs. So there is a so it is actually not very good to have the auricle, because it can readily form thrombi, which can cause pulmonary embolism. So all these are the features of the right atrium.